Just stay tuned, call somebody, let them know that we're on the air. This will be streamed, as well as we will be doing this repeatedly on the UCOM and Unity TV broadcast. I would like to give a special thank you to Dr. Eric Fales, who put all of this in motion. He worked real fast. I contacted him on Friday, and he had me in contact with Dr. Reyes on Saturday, and today is Sunday, and Dr. Reyes is here. We want to thank each one at Baptist Hospital. We want to thank our healthcare physicians, our nurses, everybody that is putting your life online to save us, to work through this coronavirus. So we thank you for tuning in. We now turn you in the hands of Dr. Reyes.
Thank you, Dr. Jones. It is very intense. Summarizing so far, the mode of transmission of this disease is like the flu: contact and droplet. We need to maintain social distancing. We need to wash our hands, and we need to know how we touch things, and then we touch our faces. We have talked about the symptoms, the main symptoms: cough, fever, and fatigue and muscle pain. There are other symptoms that have been reported, like diarrhea, headaches, sore throat, sneezing, runny nose, but those are not the most frequent symptoms. The more frequent symptoms are cough, fever, and pain, muscle pain, fatigue. I have been also asked about if there are underlying conditions that make this infection worse. And there is. Also from the CDC from China, their documentation shows that cardiovascular comorbidities, meaning hypertension or heart disease, it is one of the most common comorbidities that can make patients critical. Imagine that. Those are the ones that are more prevalent in our community. Also, diabetes is being linked in a lesser intense, and any immunosuppression also has been linked to worse outcomes or critical condition. I have been asked also about the use of aspirin and other non-steroidal anti-inflammatories. There is no hard data on that. There are anecdotic medical papers out there that patients that took NSAIDs at the beginning of their illness had a worsened course, but that is not proven. Due to those early isolated cases, some experts are recommended to use Tylenol for fever and not ibuprofen or aspirins. But again, that data is not confirmed. So we will know a little more over time. I have been asked also about supposedly do not resuscitate that has been passed. To my knowledge, there is nothing that has been placed on effect. Our community should understand that we healthcare providers are bound by oath to do everything we can to save a patient's life. Unless there is a do not resuscitate order in place by the patient or by the family member of the patient that is the next of kin, we physicians will continue to do all our efforts to save that person. But we also have to take in consideration that when we have a patient that goes into cardiac arrest and has comorbidities, the possibilities of getting that patient to recover that patient are 1 to 4%. When a patient goes into cardiac arrest, it's an emergency. And with all the personal protective equipment that you have to use for this type of patients that are positive for COVID-19, you have 10 to 15 people inside of these rooms when there is a resuscitation attempt. So should we, with those percentages, shouldn't we maybe start thinking and talking to our loved ones? What will we do in those situations? Or what is that we want to do for ourselves in those situations? 1 to 4% is the survival rate of trying to resuscitate patients with coronavirus. Should we put at risk those 15 to 20 people? Of course, if we still want that for ourselves, that should go on record. But we should start talking about this. We should start talking, if I go into this, I want this or I want that. We need to communicate and talk about these end-of-life situations. It will be easier for a healthcare provider to know what to do in that moment, because if the person says, I really do not want, if I get to the point in which my heart stops, I do not want to go through those efforts, and the patient itself or the family member can place a do not resuscitate. But we will not take that in our hands. We can't. As I mentioned, we are bound by oath to do everything to save patients' life. But we need to start talking in our houses. What is that we want? Dr. Jones, remind me of other questions that were pending.
You answered most of my questions. You answered most.
Past, there was, vaccine, yes. Well, there are vaccines, doing a vaccine is not that easy. Doing a vaccine, it takes a lot of steps and different type of trials, because you have to test these vaccines on human beings. So yes, there are ongoing research on vaccines, and hopefully in the next 6 to 9 months we see a product, but it has to be tested on human beings. Another question that was out there was, if you get infected with COVID-19, can you get it again? And from what we know or what we have seen, it seems to be that patients that develop the disease develop immunity, but not everybody develops the same immunity, or people that have different type of immunosuppression status may not develop, or immune deficiencies may not develop a immunity to the disease. So far, seems like we do, but we will know a little more over time. Another question was about treatment. There is no treatment for COVID-19, not approved treatment. There is research ongoing. Seems like an antiviral that has been used before for Ebola may have good effects. The rest of medications that we are using are anecdotal and have not proved to be a cure. So we have no cure, but we do have a prevention, and we need to work in the prevention. Why to look for a treatment when we can prevent? Sir?
In preventing, we've been told to use Lysol. Is there a proper way to use Lysol and other cleaners?
The question is, in order to prevent when we are cleaning surfaces, is Lysol a good product? There is a list of products, EPA products, in the CDC webpage. There is a list with the name, the code. You can use any product that is there to clean surfaces. Any product. I will not mention product names through this channel, but there are, if you go to CDC, it says the name, the code, it says EPA on how to prevent in the CDC. It's all, the whole list of approved cleaners, and it will say also to prevent, wash your hands. So yes, you have to constantly be cleaning your tables, cleaning the house, cleaning the rails. You know, we have to be very careful, and we start to think constantly, what is that we are touching? What is that when we are bringing? There was another question, who should be using a mask? Well, it depends where. That's an extremely complicated question, and it has several levels of answers. When we have a patient in the hospital, we have to use a special, it's called PPE, personal protective equipment. Every hospital will follow the recommendations of CDC, WHO, and those patients need to be in a room by themselves, and there is a specific gowns, a specific gloves, a specific masks, a specific eye protection. That is mandatory that we use a special PPE, personal protective equipment. That is for the hospital, inside of the room, and everything gets stripped down, you know, once the patient, the healthcare provider gets out of that room. So those will use the highest levels of mask that the hospital will have. If we go by the idea of social distancing, for what I explained, it will also depend in which moment of the epidemic we are. If we are in the beginning of the bell shape, you don't need a mask. But when you start going in the ramping, in the algorithm number of cases, what we call widespread in the community, then every person that violates the 6 feet rule should be using some sort of protection. It doesn't have to be necessarily the equipment that we use in the hospital, but we say cover your cough. No, you're covering with your arm. it is a protection. So that way it doesn't get into the surfaces or into somebody else. So anybody that is sick, has respiratory symptoms, should be using any type of mask, scarf, or anything to cover, to control those secretions from the mouth. It makes sense. You don't have to be a doctor for that piece. If you are coughing, instead of coughing to the air, inside your own house, even for the patients that we have in the hospital, they should be using a mask. You know? Any type of mask. Even if you made it at home. A cloth mask. Some people are using masks that have filters inside. Very ingenious, very creative. This doesn't work for the hospital, because in the hospital we need to have a specific protective PPE. But outside, if somebody's sick at home, covering the mouth with a scarf, with a cloth mask will work. In any situation in which we are within the 6 feet, we need to cover our mouth. And we need to be creative. Yesterday was the first day that I took off since March 9th. The first day. I still went to the clinic for 10 minutes in the morning, I'm not gonna lie, to talk to the providers. To talk to the providers in the clinic, in the coronavirus clinic, just for 10 minutes. But then I spent the whole day at home, trying to see how is that I could create with homemade equipment that it could prevent to spread our droplets if we start, or somebody getting into the droplets of somebody else. So I got creative. I saw some videos, and I saw a baseball cap. I put a laminated. The problem with this one is that it doesn't take my glasses. So I needed to be a little more creative. I said, okay, this is for outside when I have to go to the store. So I said, well, I like to ride my bicycle. Whoever knows me personally or in my neighborhood, they see me on my bicycle playing music at 5 a.m., 6 a.m. in my neighborhood. So I said I can do something with my helmet. This one takes my glasses pretty well. So if I cough or somebody coughs, this will protect. Of course, I have to clean it with APA approved products. But I became creative, and my family appreciated that I was home, and that we became creative with the kids, trying to do something for ourselves when we go to the store. The problem is that when we go to the store, not everybody is, keeping that distance. And I don't know how everybody is so responsible, if they are responsible enough to keep the distance, or if they were a little sick, that they are not covering their cough or their sneeze. So I may look ridiculous with that. But I know that I am protecting myself. I know that I'm protecting my children. In my house, from my own house, nobody can leave the house unless we say, where are we going? I mean, I have to go to the hospital. Where is my wife going? I'm going to stay with the kids. She goes, or I go. I feel a little more comfortable on the touching or no touching, so I go to Publix, do a couple of I buy a couple of things that we need. You know, I don't want to buy absolutely everything because then somebody else will not have what to eat that day. So we have to be thoughtful too. Oh, I took all the sanitizer. I'm not going to get infected. Well, you will, because the sanitizer that you took, that it was for everybody in this room, then they don't have the sanitizer. You do. You clean your hands. But everybody gets sick. And then when they knock on your door to ask for help, you will get infected. So not thinking in the community, in your neighbor, in your friends. You have to think in community. And nowadays, it's not. I was sharing the link this morning, and my cousin, when he saw the church link, he said, "Carlos, you're not Catholic anymore?" Oh no, of course I'm Catholic. I'm going with my brothers of this community that they have given me a channel to talk. It's not a matter of Catholic, Muslim, youth. It's a matter of human beings. It's a matter of community. It doesn't matter if you go to this hospital or this hospital, if you go to Baptist Hospital or Jackson Hospital. It doesn't go if you go to private school or public school. It doesn't matter. We all are brothers and sisters and children. God is looking at us, or in what we believe. We are going to be judged one day for this. We need to prevent this infection. We cannot get to 37 deaths in Alabama. We cannot. We cannot. They are telling us there is going to be 37 deaths. We already have 9. We can do something about it. Why to fight on the treatment when we can prevent this? Doesn't it make sense? Some people are already sick. Some people are fighting for their lives, in the ICUs of our hospitals in the community. There's not much we can do there. But we can do something about prevention. Prevention is our treatment. It is not when the patient gets to me, it may be too late. It's better that we prevent. There are clinics in our community. There is a clinic here in the Boulevard. There's a clinic in Prattville where you can make a call and get let me get the number here. And get an appointment. So if you have any symptom like cough, fever, and fatigue or shortness of breath, you should call 334-747-0150. You will be screened by a healthcare provider, and they will let you know if you are screened in to rule out coronavirus. 334-747-0150. You call that number and you will be given instructions to come to the specific address, to park in a specific parking lot. A doctor or a nurse practitioner will come to you and ask you some questions, and if they consider clinically that you need to be tested, you will be tested, and you will be called with your results. Another question was, what to do if I test positive or if I'm ill with COVID-19? Well, it depends on your symptoms. If what you have is fever, cough, and pain, you may just go home and recover. But if you have shortness of breath, meaning the respiratory rate is increased, and you're gasping for air, well, you need to go to an emergency room, because you may need further treatment, or you may need oxygen, or you may even need mechanical ventilation. So it is better to call ahead. If you tested positive in one of these clinics or hospitals, if you test positive, you go home. If they see that if we change our behavior.
To Pastor Jerry Davis and his lovely wife, Mother Davis, for opening the doors to come in and brief us, to bring the doctor here to brief us about this virus. It's very important. There are so many people that is living in fear. There are so many people that really don't know what to do. But, for our doctor to come out and enlighten us, we do thank him. And those of you that is tuning in, we encourage you to just continue to watch, because we will show this in its entirety. I think we have about 3 shows by way of broadcast. We will do back-to-back episodes of this. We thank Greater Grace Media Team, amen, for streaming, for everything that they are doing to get the news out. We thank you all. Thank God for UCOM in Unity. We thank you, our editor, each one that is going to bring this out to our community. Getting ready to go into about 50 million homes, and I think that we will be ready to get this out there in the very near future. So we thank you again, Doctor. Thank God for Baptist Hospital for the care that they gave to my mother, who by way I met Dr. Eric by phone, and Dr. We thank you for being with us. So until next time, may God bless you, may God be with you, and as we always say, put God first, and remember, God did not give us the spirit of fear, but he gave us power, love, and a sound mind, and that's what it's going to take during this time. It's going to take that sound mind. Thank you, and God bless you.